So one thing I really want you to remember is that repeated drug exposure changes brain functioning. It's very important. That's what makes addiction a brain disease. It's not a problem with character or something like that. It's very different. So if we look at PET scans, I'm going to show you an illustration of this that shows some brain changes in dopamine receptors resulting from addiction to different substances like cocaine, methamphetamine, alcohol, or heroin. There's an area called the striatum, which the striatum contains the reward circuitry and part of the motor circuitry. The central reward pathway is called the mesolimbic system. That goes from the ventral tegmental area to the nucleus accumbens. I mean, you don't really need to know that, but that's where the dopamine receptors are. And the dopamine receptors that are predominant in that area are the D2 receptors, or dopamine D2 receptors. There's various different types of dopamine receptors. So if we look at this picture that's coming up next, you're going to see that the brains of addicted individuals show less intense signaling, and what they're looking at here are the levels of dopamine D2 receptors. So here you can see that these are the control subjects, and here are the addiction group, and here we're looking at D2 receptor availability. So you want to look at this area in the red that shows lots of density of the D2 receptors, and then in the individuals with the addiction problems you can see that it doesn't light up quite as bright. So I mean, that should be pretty straightforward. This is an interesting line of research, and it should continue to give us more insight into the neurobiology of addiction. You know, that's really the future of the psychology and physiology of addiction, is looking at the neurobiology. I put a link in your Blackboard class for an article by David Eagleman about neuroscience and irrational drug policy. I'd like you to read that. It kind of goes over some of the stuff that we're talking about here. Again, that addiction film, the HBO film, is super important, so make sure you watch that. You know, this area is something that you could study for the rest of your life and not know everything. But now you have some of the basic knowledge about the physiology of substance abuse. We've covered that more. You know the basic ways that many drugs of abuse, illegal drugs, legal drugs, over-the-counter drugs, prescription drugs work. And I would really encourage you to keep active in this area, especially if you're going to be working in the substance abuse field. The more you know about how these drugs work physiologically, the better able you'll be to help patients. Now, I want to go over one last thing, and that's kind of like my little wrap-up of the class. So I'm going to switch to a little different slide here. So what I'm going to do is just cover some areas that I think are important future directions in this area. I go over these in a lot of different classes. This is just kind of the summary of how I think things should work out. I mean, my background is really in forensic psychology, neuropsychology, and substance abuse, but I do a lot of work in criminal justice as well. So a lot of this is kind of focused on that. But remember, substance abuse is typically associated with illegal behavior, and I think that's very important. So the first thing that I think we should do is, when somebody is arrested for a drug offense, or even a DUI or something like that, in lieu of incarceration, I think we really need to focus our efforts on treatment. So in the entire budget on the war on drugs, the United States spends ridiculous amounts of money, but less than a quarter is spent for treatment. I think we'd be much better off freeing up our resources that we use for incarceration and use those for treatment. In light of that, we should focus our criminal penalties on traffickers, not users of drugs. If you look at incarceration rates the rates for possession are far higher than for trafficking. I mean, that should kind of make sense in that somebody that's a drug dealer would be selling to multiple people. But there are huge amounts of drugs that are coming into this country, and I think if we focus on the traffickers for criminal penalties, I think that we would be better off. You're not going to ever stop the flow of illegal drugs. I mean, drugs have been a part of human history since recorded history, and if you suppress one area, it'll just pop up in another. However, I don't think you should ruin a kid's life for marijuana possession. Alright, so that said, in our criminal justice system right now, we do not do a very good job of providing treatment for individuals with substance abuse problems, and we really need to provide serious help for individuals with substance abuse problems within the criminal justice system in the United States. Another problem in the public is that we don't take treatment seriously. There's a nice picture of Lindsay Lohan right there, and you know, like, her treatment has been conceptualized as like a joke, and that's not okay. Treatment needs to be taken very seriously. Then the next thing we need to do is make treatment user-friendly. I'm not sure if any of you have ever tried to access substance abuse treatment, but it's not easy. It's very difficult. So just as an exercise, try and find substance abuse treatment. Just go to a phone book, see if you can find a treatment program, something like that. Call your insurance company. It's difficult. Another thing we need to do is link treatment with harm reduction. Harm reduction is a really pretty controversial topic, especially in the United States. I like the concepts of harm reduction. If you don't know what harm reduction is, why don't you take the time to Google it. So harm reduction acknowledges that no matter what we do, people are going to abuse drugs. So why don't we do it in a way that will reduce the harm to the individual and society as a whole? It's a pretty different approach. It doesn't condemn drug use by any means. It just acknowledges that this is going to be a problem that we're going to have to address. So why don't we do it in a way that keeps people safe? Another thing that we need to do is make aftercare a priority. Aftercare is something that you do after somebody has been through treatment, and aftercare is very important. Now, I don't talk too much about specific treatment programs, but one thing I do want to differentiate is between the 12-step programs. The 12-step programs like Alcoholics Anonymous or Narcotics Anonymous, when somebody goes to a program like that, they're already supposed to be abstinent from the substance. So you're supposed to have stopped drinking or stopped doing drugs prior to attending those meetings. That's not what treatment is in my conceptualization. However, those programs are excellent for aftercare, and we need to link treatment with aftercare and make aftercare a priority. Doing that will help ensure success in a substance abuse treatment and will ultimately hopefully reduce the rates of relapse. Another thing we should do is link treatment to work. A lot of people that have substance abuse problems don't have a job. If we link treatment to work, that could be very beneficial for people. Another thing that we need to do is redefine what we consider to be effective treatment. Now, effective treatment to some people might mean that somebody totally stops using a drug. And really, that's a goal. I mean, that is the absolute goal. But even in like psychiatry or psychiatric drug research, they don't consider successful treatment of depression a total absence of depression. They consider it a reduction by 50% in the symptoms. So maybe we should do the same thing for substance abuse treatment. And if we did that, I'm sure we would see the development of empirical evidence supporting other types of treatment. So instead of just total abstinence from a drug, maybe effective treatment could include just reduced drug use, improved vocational functioning, improved educational functioning, improved interpersonal relationships, improved medical status and general health, improve legal status, improve mental health status, and improve non-criminal public safety factors. If you see all those things, that's where we're coming from when I talk about the systems perspective. So it's not just addressing the substance abuse, it's addressing all the other areas that that individual has in their life that they could use improvement. Another thing that we could really do is free up the money that is spent within the criminal justice system and use that money for treatment and research. Really, I think that would be incredibly beneficial. So we spend a huge amount of money incarcerating individuals in this country, and by doing so, it kind of makes the criminal justice system our like de facto treatment venue for substance abusers. I mean, that's really bad. We have over 2 million people incarcerated in the United States right now, and if you look at state and federal prisons, you're looking at right around half of the people are there for drug crimes. It's ridiculous. Incarcerating somebody is not going to change the way that their brain works, and by now in this class you should realize that. Now, we haven't talked about this too much in this class, but evidence-based practice methods means that the treatment that we use is based on science. So there's research evidence supporting that the treatment actually works. This is super important for this area, and I feel like I haven't stressed that point enough. We didn't really talk about that, but that's like the stuff that's in the research journals. So just because somebody has a good idea for a substance abuse treatment doesn't mean it's going to work. Like the DARE program is a great idea. Drug abuse resistance education that was done in schools for years and years and years. Tremendous amounts of money were spent on that program, but it didn't work. It was ridiculous. We need to develop programs that actually work and are supported by research as being effective. And the last thing that we need to do here, you see the brain and the pills and the society and the family there, genes. What we really need to do is conceptualize the substance abuse problems from the systems approach. Even though I talk about the neurobiology of addiction and stuff like that, we need to look at this from the cell all the way up to society as a whole. And if we do that, we'll have a better understanding of substance abuse problems and how we treat those associated problems. So that's it. Those are my ideas for how we can make things better in our country and in the world as a whole. You know, some of those things are a little controversial and you might not agree with them. That's fine. Those are my opinions. But I think they're good ideas, and they're, you know, they've got empirical evidence to support that I stand on pretty solid ground. So I hope you've enjoyed the class. I hope this has changed the way you think about some of these issues. And again, I hope you have the resources now to tackle some of these issues potentially in your future career, or have a better understanding of them, because substance abuse, substance dependence, addiction knows no boundaries. Is something that we will all have to unfortunately deal with at some point in time in our life, whether it's personally, professionally, friends, family, co-workers. It's something that is just part of human life, and by taking this class you'll have a better understanding of that. So that's it. Study for the final exam, and good luck. Let me know if you need anything.